We are out on the weather patio today with Dr. Stone from the Helen DeVos Children's Hospital Congenital Heart Center here in Lansing, which is a mouthful for sure.
It is.
If people aren't familiar with the hospital or the center here in Lansing, explain what the hospital and center does.
Yeah, we are a comprehensive heart center here in the Lansing area that's been serving the Greater Lansing Community for over 30 years. We've been a part of Helen DeVos Children's Hospital team since 2007.
And Helen DeVos Children's Hospital in Grand Rapids.
Correct. We joined the team back in 2007.
Tell us what kind of patients you treat there.
We take care of patients in terms of ages anywhere from fetal life up until adulthood in patients born with heart problems, which we call congenital heart defects.
And what kind of conditions is that? I mean, not to get too doctor talk with us.
Sure. So many of the patients we take care of are coming in to rule out a heart problem. So they might come in with chest pain, dizziness, fainting, for instance. On the other hand, we might have patients born with heart problems with what we would call congenital heart disease, where they may have a hole between the top two chambers of the heart, a hole between the bottom two chambers of the heart. Some patients are born with critical narrowings right at birth that we have to take care of and act accordingly.
And how does that work? If a patient comes to Helen DeVos Children's Hospital Congenital Heart Center in Lansing, are they referred from another doctor, or can they come in? Is that how that works?
Yeah, that's a great question. So we typically get referrals from family physicians, pediatricians, nurse practitioners in the area. And typically within 24 to 48 hours of the time of referral, we're able to accommodate. And sometimes in urgent scenarios, we're able to get people in on the same day.
You kind of answered my next question about how long it takes for people to get seen, because I think a lot of people have concerns. Well, if I'm going to go, I'm going to have to wait 3 months to get an appointment? But that's not the case.
Absolutely. And things that we may take for granted that are basic, like we see a lot of chest pain that might just be from the chest wall, what we would call musculoskeletal chest pain. Somebody might have injured themselves and they're having chest pain and they want to rule out a heart problem, or just teenagers and adolescents may have this type of pain and we want to rule out a problem. So it may be simple to us, but very concerning to the family. So getting them in promptly is really important.
Oh yeah, because the parents have enough to worry about in this day and age. So
Absolutely.
How has the pandemic affected you guys in the way that you treat patients?
Yeah, we've been up and running pretty much since the beginning of it. There was a very short period of time where we were doing a lot of virtual visits. We still do have that option to do virtual visits if necessary. We are also seeing patients who have had COVID and want to rule out any post or after COVID complications.
All right, and it's important too, because a lot of families, if their child is sick, they don't want to have to lug them over to Grand Rapids, and do that drive there and then come back. So it's important that people can come see you here in the Lansing area.
Sure, absolutely. The point of care here in Lansing, we serve a wide range of patients in terms of the locations. So we see patients actually over to the east in Flint, Grand Blanc. We see patients to the north, Mount Pleasant. So we have patients that come to see us from a long range of distances, and accommodating them here in Lansing is great.
And keep them close to home.
That's very true. We also have outreach clinics where we actually go and physically see patients in Owasso and Mount Pleasant to serve those patients that may have difficulty in accommodating them at those clinics.
Well, doctor, thank you so much for the information today.
Thank you for having me.
We appreciate it, and stick around. There's still more to come on Studio 10.